Fatal drug overdoses are expected to break records in San Francisco this year, with the powerful opioid fentanyl continuing to push the death toll higher and higher.
KRON 4's Maureen takes a closer look at the life-saving drug Narcan, which she used herself to save one man's life this week.
If you don't give me a response, I'm going to end up having a Narcan. I don't want to have to do that.
Bill Buellman is using his colleague at Health Right 360 to give me a refresher course on how to administer Narcan or naloxone, which can reverse the effects of an opioid overdose. I had a firsthand experience giving doses of the life-saving drug on Monday morning to a young man who had been non-responsive and turning blue on a corner of Potrero Hill as we waited for first responders you see in this video to arrive. If trying to rouse the potential OD victim verbally and then with a sternum rub fails, Buellman then sticks the Narcan dispenser up a nostril.
And then I want to give it a good press so as much of the medicine as possible gets up in there.
Narcan comes in a 2-dose box, and it's recommended to wait 2 to 3 minutes before giving the second round if needed. But Buellman says with the powerful opioid fentanyl, sometimes even just 2 sprays won't cut it.
Because there aren't ill effects from mistakenly administering naloxone, it makes it very easy and safe to administer.
Last year, the Department of Public Health, through community partners and other city agencies, including the fire department, gave out more than 60,000 doses and expects to give out even more this year.
Our goal is to put this effective tool in the hands of people who can respond, who are often people themselves who use drugs, who themselves might be at risk for overdose. And this is a tool to help people take care of each other.
You have to respond very quickly to a fentanyl overdose in comparison to a heroin overdose if you want to prevent a fatality.
Buellman himself has been on the receiving end of Narcan approximately 7 times, including once at this hotel, before going into treatment in 1999 and turning his life around. Since then, he says he's lost track of how many times he's performed the life-saving act over the last 20 years in his work in harm reduction.
Every single person who's using fentanyl is somebody's wife, husband, daughter, sister, brother, and every life is worth saving.
As he points out, dead people don't get a chance to change. Maureen, KRON 4 News.
Maureen's a hero.
She really is.
I'm from San Francisco. I was born and raised here, and I still live here. I see the homeless problem in this city every day, and now you're going to see it too. Strapped with this cell phone, I'm going to be giving you an up-close look inside the crisis while I try to find out why it doesn't seem to be getting much better.
You don't have to walk far in San Francisco to see it. People passed out on the pavement. Tents and garbage taking over the sidewalk. Certain streets jammed with rundown RVs. Even though I grew up in this city, there are places I don't feel safe getting out of the car to show you. This is recent video from Larkin Street in the Tenderloin. A sense of lawlessness just steps away from the federal courthouse. And while the problem with homelessness and drug use is not on every corner, you can't easily escape it. While walking on the Embarcadero, a man began shooting up right in front of me. If you live or work here, the attitudes towards homeless people vary.
Help me.
There's compassion. There's acceptance. Some are just fed up.
I don't really know the best way to handle it, but what I want to see is people who are violent and aggressive off the street.
And while it's easy to blame horrific street scenes on the homeless, I'm learning it's a lot more complicated. That's because I'm not just shooting video, I'm also taking the time to listen.
I'm a reporter with Channel 4. I just want to know if I can talk to you.
Some say they were forced out.
No, they're selling the property, so basically we had to get out.
Some can't seem to find a way out.
Are you trying to get any services?
I tried, but they didn't really want to help me. They denied me.
Some tell me they just want to stay put.
Most of the hotels they get a hold of are usually full of packs of tweakers, twacks, and a bunch of other people, and I don't like to be around them.
This your tattoo is like railroad, I think.
Some say they're just passing through.
For the past 2 years, we've been freight train riding.
So now what? We've all seen the headlines that change is coming. $12 billion to support homeless. New program after new program. Is any of it a real reason for hope? It's time to find out. In the coming months, KRON 4 will be taking you inside the crisis in San Francisco, getting answers from city leaders, looking into the programs meant to help, and figure out what's actually working on the streets. But I can't do it alone. That's why we've started a tip line. If there's something I need to see or know to help understand this crisis, email me onthestreets@cron4.com. Maybe by looking at the problem from a different perspective, together we can make a difference. Reporting on the streets, I'm Maureen Kelly, Cron 4 News.